Hi, my name is Josh Dion. I work at Viking Medical Group, and I'm going to demonstrate how we insert testosterone pellets for our female patients. First step, I've gotten it all prepped up here on my tray. A couple kits. We have 2% lidocaine with epinephrine, alcohol swabs, and a prep for sterility. So I'm going to mark the gluteus medius, kind of in front of the entry point, and then I draw a line for the path of the pellet, prep it with alcohol. And this particular patient has had many of these pellets, so she is aware of the process. Well, normally I'd be telling the patient what I'm doing, exactly the process of going through, when I'm gonna inject the lidocaine and when I'm gonna puncture the skin and place the pellet itself. Do you have any questions?
No.
But basically grab a good chunk and then pierce the skin. I start top, kind of bury the needle right down, pull back, and go in a lateral fashion. It's really towards the hip. Put a good amount, usually 10 to 12 cc's of lidocaine. How was that?
Good.
Usually tell the patient you're going to feel it burn. If they feel a pinch, obviously it's a needle. And I told them they burn lasts, I don't know, maybe 50 seconds. And then it's gone. Because lidocaine's acid. These pellets are done typically every 3 to 4 months. She was a little overdue for this one, so she can feel the dip. Now I change gloves. I will show you, this is 100 milligrams of testosterone. That is the size of the pellet, very small. Blow it into my gun. This brand that we use, we've been using for 3 years. This is the punch scalpel. We're waiting for it to numb up. Typically, you can see the skin will blanch from the epinephrine, so you know that it's superficial. You can see the cap area. So drape. And then with the women for testosterone pellets, we have them take a supplement called DIM. It helps get rid of excess estradiol, which can be problematic for women. Typically, people will notice increased breast sensitivity and soreness. With the DIM, that kind of eliminates that. But other than that, there's nothing else that goes with the testosterone, progesterone. All right. A, B. Feel A.
I feel A little bit, and B with
B is stout.
yeah, B with just pressure. Where just the one more time.
A.
Yep. Elite.
How about this?
I found the thing.
Nothing. Okay. All right, so we will make the puncture. We're going to take our trocar, our tool, comes down to the skin. This is just a style of tool. I think most of them are probably the same, to be honest with you. We need this kind of tunnel it under. You good?
Mm-hmm.
Some people are tougher than others. Depends on the layer of fat, to be honest with you. She doesn't have much, so it's a little more tricky again. And then we just close it with steri strips. And it stays in place for 5 days. You can tell them no swimming, don't soak it, they can shower to make sure they don't take the wand off the wall and start blasting it. But other than that, we've done about 600 of them and haven't had any infections, knock on wood. Everything seems to heal pretty well. It's a very small incision. You ever had any issues with steri strips?
No.
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 And then we do labs, repeat labs. So after the first pellet, we'll do a lab in 6 weeks. And that will be the peak. And then we do another lab at 12 weeks. That will be the trough. And then after the first pellet, so after those 2 sets of labs, what we do is we will do every 12 weeks just before the next pellet. And typically it's about, the level is still higher than original, but they're much lower. So the patient usually can tell our goal is between 150 and 200 for a total testosterone and free testosterone based on sex hormone binding globulin level is proportionate. Once it gets below a certain number, patients will start to feel fatigue again. They might notice a little bit less energy as far as like motivation to work out, those types of things. And they repeat it. We watch all the labs every single time, so we're always looking at multiple different hormone levels, including cortisol, thyroid, in case something changes. Not related to the pellet, but in general. That is it. You are set.